All right, here we go. So we call the meeting to order. It's, I've got 12:08 PM. You got enough group here? I'm
We
assuming?
do, yes,
Okay.
sir. And we have nobody on Zoom, I don't think.
Nobody on Zoom, okay. So first order of business, we're going to ask for the approval of the 1/29/2025 and 3/3/2025 meeting minutes. So I need a motion for that. So move Kenny Hale, second. Second, Judge. Thank you very much. All in favor, say aye.
Aye.
All opposed, same. Okay, we'll move on to new business. Brian?
Yes, I kind of relate, I guess, I think at the last meeting, we had mentioned a couple times about the public meeting availability and what that means to the Community Corrections Advisory Board, and that's per House Enrolled Act 1167, would be to live stream our meetings and provide that link that is available now on our website. This goes into effect July 1st, so we kind of looked at taking the opportunity today, at today's meeting, to go ahead and try it. So we will have our minutes and agenda and a live link all posted, and they are currently posted now, starting today through the county website, through Morgan County Community Corrections, through the court services window of the county website. So I wanted to mention that, and that, I guess, is it. Does anybody have any questions about that?
You need a motion on that?
I do not.
Okay. Go ahead to the 2025-26 JCC grant approval also, Brian.
Yes, sir. We applied several months ago for the juvenile grant for the fiscal year of 26. That was flatlined, if everybody remembers. So the amount we're going to receive from the state is $92,851. That was approved. I've received an email that was approved, but we have not received the official award or the official notification letter that we're expecting any day. That grant period will start July 1st. So I wanted to let everybody know that was at least approved. We received information that was approved. Does anybody have any questions about the juvenile grant?
Motion on that?
I do not, sir.
Okay, we'll move on to 2024 JCC grant financial audit results also, Brian.
Yes, sir. We just go from one audit to the next, it seems like. And I know Carly, our community correction assistant, can vouch for that. But our juvenile grant financial audit was officially completed in early March. So we received notification that we had no findings, which is very good news. And it's been consistent that we don't receive any findings. So everything was accounted for. I don't need anything approved. We are currently in the process of being audited for our adult community correction and jail treatment grants too.
Okay, we'll move on now to 2025 first quarter pretrial supervision report, please. Miranda? Oh, I didn't check that. Well, yeah, I'm sorry, electronic monitoring report. That's you too, Brian.
That's me again. I'm talking again, so I'm trying to talk fast. But this again, and I've repeated this because this is still somewhat new, but it is a report that is required to go through local JRACs now. So this has already been approved, the last JRAC meeting, to submit to the state of Indiana. But it is basically our home detention statistics for the quarter. And we had 35 adult post-supervision cases. We had a pretrial supervision for both juvenile and adult during the quarter as well. Of note, at the end of the quarter, we had 24 active adults on home detention. This number does not include offenders that may be on electronic SoberLink alcohol monitoring. That is reported separately. We had 9 that completed on the adult side and 1 juvenile, and then we had 2 that were terminated for a technical violation on the adult side. So 9 successful, 2 violated. The financial, again, is linked to the amount of monies that are levied through our software system. So those vary over time, but it projects fees that are entered that are owed at the time they're placed on supervision. So it could far exceed the current quarter for the total balances. But both those are pretty consistent numbers. And then we have to report our false location alerts and device malfunctions, which were 26 for adult, 1 for juvenile, and 3 adult for the device malfunctions, which are, you have to explain in your report, but it's all technical jargon that really doesn't tell the state of Indiana much because people have their own local interpretations for what that means. There is a statute that I'm not quite sure if that passed or not, and legislation for this coming year that removed one of those requirements, but we have not received notifications. So that may change what our reporting requirement could be. But that being said, I do not need approval, but I would entertain any questions anybody has about that report.
Questions? Okay, now Miranda.
Can I go ahead and throw one thing that was not on the agenda on there, since I've been talking the whole time anyway? I just wanted to throw out there that we do have a current opening. We had a resignation of our community supervision officer, so that has already been posted. And it's really hard to foresee what 2026 is going to bring. I talked with Councilwoman Vicky right before the meeting today to get a little input on what she knew, and I don't know. I mean, it's hard to envision what's going to happen. I know from the information we've received up to date that the community corrections funds for 2026 have been cut by $7 million. That is about 10% of what is allocated statewide. You know, if they cut 10% of our community corrections budget, which is over $330,000, that's significant. And you can't get to certain points without cutting people. I mean, I only have so much paper and gasoline that we're buying, and it's not to levels that exceed those amounts. So that being said, I think that we got to be cautious in what we do and how we do it, and think out of the box. You know, hopefully local funding won't take that kind of hit, but I don't know. We don't know. So I just wanted to kind of say that we'll have to see how it goes. The revised community correction budget is currently the timeline. That is due August 1st. So I will have to submit that. That tells you that the state would have to let us know what those amounts would be if they are different. But I have heard no official response of whether that's what they would entertain cutting people, or if it would be more individualized in scrutiny, or how they would manage those funds. Does anybody have any questions? Judge? Well, I think that it's hard to envision before you know what exact monies we're looking at. But I think that if we truly are going to lose approximately $30,000 in the community corrections grant, I would certainly entertain not funding a community supervision officer above anything. And there are some more things that I'm going to relay at our judges meeting tomorrow for the judges that are in attendance to give a little more vision. But I think that in doing that, without going on and on, it would involve allowing some of our an adult position to have the ability to fall under a job description that allows them to help with community corrections and probation at the same time. Yeah, and that one, Judge, would be funded separate from community corrections, so it would not be under this umbrella directly, although I'd want to relay some administration questions further up the line. But it would allow us to use our current funding, you know, and use our resources kind of in an enhanced way to help with community corrections. Not in services, no. But in staffing, you know, the target would be the community supervision officer position that's currently open. And we would have to proceed accordingly, yeah. But it's you know, if you cut other things, I mean, you're not going to get to those amounts by just cutting supply line stuff. I mean, it's fringe and salary that's costing money, and that's the same thing for the county. I mean, unless you're funding a building or some project, you know, it's people primarily, at least for our world. Thank you, Judge. Any other questions?
Okay.
All right, thanks, Sheriff.
Thank you, Brian. Miranda?
Our first quarter 2025 pretrial supervision report, we did 96 assessments in the first quarter of 25. Comparing that to the fourth quarter of 24, there were 98. So all of these first quarter numbers are very similar to what they were in fourth quarter of 24 and also to what they were the first quarter of last year. 57 people were placed on supervision, comparing that to the previous quarter when there were 61, again, very similar. At the end of the quarter, we had 145 people on active pretrial supervision. We do have one person with special conditions. Last quarter, we did not have anyone with special conditions, and we had 140 people active at the end of the quarter. Case closures, we closed 53 cases first quarter of 25. That's compared to 60 fourth quarter of 24. Our success rate, we had 57% of the people completing successfully first quarter of this year compared to 55% fourth quarter of last year. So also very similar. Does anyone have any questions about the pretrial supervision report?
No questions? You move on? Go ahead, Miranda.
This is also just informational. Our local JRAC team update. JRAC continues to meet monthly as of right now. We continue to review data as it becomes available from the various agencies that participate in JRAC. Also, our court community outreach liaison, Joni Bishop, spearheaded the critical incident stress management training, both for administrators and then for staff. The staff training occurred last quarter. And our current project that we're working on is we are scheduled for a SIM mapping workshop with the state. That's the sequential intercept model, and I can give you a full explanation if anyone's, we've talked about it a lot. So I think most people are kind of familiar, have heard that before, but we do have that scheduled for September of this year with the state for them to come down and assist with that. So those are kind of all the projects that are in the air for local JRAC right now. Does anyone have any questions about local JRAC?
And that we will be asking for, Josh Messmer serves on the local JRAC board, so he has great input and insight into what we're doing. But we will be sending some invitations sometime soon, hopefully to get a commissioner representative and a county council representative for that. It is an expanded local workshop where the intent is to identify needs in the community. And it could be, you know, the housing. I mean, it's going to be a myriad of different things it involves, but it'll be imperative to get as much representation if we can. Our partner with NAMI is the state agency involved in mental health, and they have done, several years of these workshops, so we're going to rely on them to give us a roadmap of who to include and to try to target. And you're targeting people all the way through the complete system. So it's in some cases before they come to the ship, before they're arrested. In some cases it could be an emergency room or a crisis call that gets the person involved. And you know, what bucket do they go in? Do they go in a mental health bucket? Do they go into a criminal bucket because they've had mental health and, you know, they may have, you know, committed some small crime? And then how does your system able to triage and process that person and to look and see if there's things we could do better? So hopefully it'll be a good tool that different agencies can use as a grant tool too, to assist in getting funding all the way across the board for people that work with the populations that we work in the county. So thank you.
Questions? So shows no old business. Is that still accurate?
That is accurate?
Okay. We'll move on then to the level of supervision reports for adult community corrections.
All right, for adult community corrections and electronic monitoring, for home detention, SoberLink supervision, we received 31 this quarter. We have 48 active on supervision. You can see their risk levels down there at the bottom with high, moderate, and low risk as well as administrative. Total successful completions, we have 16. We had 2 unsuccessful. You can see the reasons for unsuccess down there. Total probation cases, 23. One of those is active pretrial supervision with special conditions. Home detention applications processed 61. Oh, I'm sorry, received 61. Applications processed 49. There you can tell whether or not they were eligible or ineligible. We did have eligible 31, ineligible 29. Evidence-based interventions, sanctions 24, incentives 191, interventions 110. Sanctions incentives to sanctions, we have 7 to 1. The community corrections staff met that 4 to 1 ratio. Intervention report, we had 75 moderate high risk office visits conducted, 68 interventions with a 91% intervention rate. 2 technical violations, 24 sanctions. We are 22 times more likely to introduce a sanction versus filing with the court. Community corrections random drug screens were at 95%. During this quarter, we did have 1 active in job seekers, and I believe that that person has moved into Job Club. MRT, which is our moral recognition therapy, we had 2 clients referred, 4 active, 1 successful, 3 unsuccessful, and 1 released from supervision. Relapse prevention referrals, that was for Gus Mathias, our relapse prevention coach. We had 3 new client referrals and 29 relapse prevention client sessions. Anybody have any questions over the home detention report?
And those, just informationally, I can add on to that, that I think sometimes we're so used to reading this off, but what that means in reality, and we're talking about this, it's sanctions, incentives, intervention reports. Those are metrics that we're trying to meet that align with the goals, the greater goals not only of our agency, but the goals that we are set through the grant, through the Department of Correction and the people and the boards we serve. We completed the CSAC, whatever acronym that is, audit that took like 3 years. I've reported that since 23 to this group. And part of what the requirements are for that is a workshop that 4 of us will be involved in July. I think it's right before we move to the new building. And there's, no matter what, they're going to give us 3 different matrix to identify and to work on. So that may, correlate into a slight change next year in what we're tracking and how we track it. But those are, these are all evidence-based. There are things that shown with study and review that are more effective ways to supervise and to handle people. So we'll tweak that if needed in appropriate areas. But I want to just set that foundation. Thank you.
Thank you, Brian. Thank you, Danielle. Are you doing juvenile too?
Yes.
All right, go to town.
Thanks. Secure detention placements, 2 males, 1 female. No non-secure placements. I apologize. Ages of juveniles placed as a result of crisis intervention: 1 male, 15 years old. Calls received for detention request and crisis intervention. There were 5 calls resulting in 7.5 outside of normal office hours. There was 1 adolescent that was placed in secure detention for intimidation. Cost of detention, $21,600. Types of offenses detained: probation violation, intimidation with a deadly weapon, possession of methamphetamine. New referrals received from the prosecuting attorney, 17. Those that participated in prevention over the last quarter was 65 participants. And at the bottom there, you can see what kind of programs were those participants participated in. The diversion program, there were 3 participants. 1 was an informal adjustment. One was a referral to another agency, a warning, or other deferrals or dismissal. Evidence-based interventions during diversion was at an 85% intervention rate. The juvenile team met that this quarter. Incentives and sanctions, there was a 10-to-1. They met this quarter.
And those are combined rates, just Danielle, I'm sorry.
Thank you.
But they're listed both in intervention and diversion,
Okay.
so they're combined.
Okay, so combined rates in that, okay. And there were 7 participants in intervention. Thanks, Brian.
Welcome.
Moral recognition therapy, there are no participants at this time. Total participants in the juvenile community corrections program, 65, and this does not include new referrals. Any questions or concerns in reference to the juvenile community corrections?
Thank you very much, Danielle. And we'll move on to Dave Rogers with jail treatment.
All right, so the residential substance abuse program this quarter, or the past quarter, January to March, we had 2 high-risk level females enrolled and 1 moderate risk level male, for a total of 3. 1 female completed the program during the quarter, and 1 male completed the program during that quarter. We had a 50% success rate in the quarter, which is kind of skewed because we didn't have that many people enrolled at that time, but the program's got more people than what shows in the quarter because it's a rolling program. Then the point of impact, and actually we had 50 applications or requests for applications. We processed 31 of those and returned 19 of those. And then point of impact, which is the other portion of that program, we had 3 actively enrolled females, 1 not sentenced out of that, and then 8 males sentenced and 3 males not sentenced within the program for a total of 15. And 4 females successfully completed in the quarter, 4 males successfully completed, 1 female and 1 male did not finish the program. Happy to answer any questions that you may have. I will report that Centerstone has been a partner that we've been trying to get started into the program, and it's been kind of rocky last year. This quarter, they actually have been very consistent. They have some new staff that they brought aboard, so that has went very well, and we're starting to get MRT started within the program again, so that's been good too. So, been received very well.
Questions on that?
Right, and we will, it's yet to be seen, you know, I mentioned the community corrections concerns. I mean, there would be some jail treatment concerns. I would think that the state would look at that in the same way. So we are now, after we were reduced a couple years ago, we're receiving state grant funding for $100,000 for this grant. So if you lose 10% of that, it'd be $90,000. But we'll just have to wait and see what that means. I know we received some opiate funding, and I know Dave's been very instrumental in trying to obtain that as a supplemental source of funding this program.
Correct. And the commissioners ultimately hold the decision-making of the opiate funds that we're receiving over the next 10 years. And last year, actually this is the second year we've received it now. Thank you, Kenny. The commissioners have granted us $87,000 out of that the past 2 years to supplement what we lost through the grant the past 2 years. And so hopefully we can continue that partnership, and the money's going for a good purpose and what it's meant for. So.
Any further questions? Jail entry? Move on to the last bit of information on our agenda is reentry.
With reentry, we have 2 active clients on supervision, 1 successful completion during the quarter, 1 unsuccessful. 1 was home detention as a direct commitment. In reference to evidence-based sanctions, we had 1 sanction, 35 incentives, 32 interventions. Of the 17 high and moderate risk office visits that were conducted, 16 contained evidence-based interventions with a 94% intervention rate. Community corrections staff met the 4-to-1 ratio with a 35-to-1 ratio with reentry clients. IRAS, we only had 1 IRAS reassessment. That is where we take the Indiana Risk and Needs Assessment and then we reassess at the end of their supervision. So they have been through RSAP or POI, and then have been moved into reentry. The total risk reduction for that client was 12, which is great. That was pretty significant. Random drug screen program was at a 95% success rate. Any questions or concerns concerning that report?
And then, or unsuccessful, was that drug-related?
Yes, Suboxone.
Further questions on the reentry? Brian, do you have anything else?
The only thing else I'd say, our next meeting will be, I believe, the last Wednesday in July. We will be over here, hopefully, right next door in the Justice Building. But I envision we will still meet in this room. If that would change, I will certainly let everybody know. But yeah, it'll be an exciting time. We're ready. We're past ready, so it'll be a busy stretch for all of us, the courts and court services, so.
Looks
Thank
like
you.
the last Wednesday in July would be July 30th at noon here.
Yes, sir.
Okay, no further business. I'll entertain a motion. Judge, motion to adjourn. Second, Vicky Kivett. All in favor, say aye.
Aye.
Thank you very much, everybody, and have a dry day.